Hello. Our presentation is on community-based homicide prevention program by Carly, Dahlia, Ipek, and Nino.
And we start by description of the population that is at risk of homicide perpetration. We found that homicide offenders are predominantly male and of older age. Often they are married or separated from their victims, which points that it can be a person mostly who is a family member to the victim. High prevalence of mental health issues, particularly depression, substance use disorders, suicidal thoughts and attempts, is also observed. Moreover, homicide perpetrators are likely to have adverse childhood experiences, and they may also be exposed to stressful or traumatic events, which is common. Situational and experiential psychosocial risks include relational or interpersonal traumas, financial difficulties, domestic conflicts. All of these are frequent precursors of homicide acts. We also found that populations at high risk of homicide perpetration are younger adult males, from 18 to 24 years old, individuals of low socioeconomic status, individuals exposed to violence, substance abusers, socially isolated individuals, and also individuals involved in organized crime. Correspondingly, we think that community-based prevention programs should target these risk groups for reduction of their propensity towards homicide perpetration. Populations at high risk of homicide victimization are refugees, individuals in high material deprivation areas, young adults from 18 to 24 years, urban residents, and female refugees. And we recommend that community-based prevention programs should target these risk groups to reduce their propensity towards homicide victimization. We also did some research on global prevalence of homicide, and we found that generally there is a decline in global prevalence of homicide observed over the past few years. More precisely, international homicide rate has decreased from 6.95 per 100,000 population in 2002 to 5.79 per 100,000 population in 2021. However, there are certain regions where homicide rates are climbing, unfortunately. These are sub-Saharan and Northern African regions. Also, socioeconomically developed region of Northern America is observing steady increase of homicide rate since 2015. I hand over to Carly for a slide on risk and protective factors.
So some risk factors to experiencing homicidal ideation include individuals' trauma history, if they're exposed to violence during development or abuse, interpersonal or relational instability, situational and acute stressors, legal history involvement, familial involvement in the criminal justice system, and then also substance use and co-occurring disorders. Maybe a risk factor to homicidal ideation, specifically in the context of interpersonal relationships or intimate partners, and alcohol and substance use. Um, Neighborhood poverty and diminished economic opportunity may also be a risk factor to homicidal ideation. Exposure to school and community or family violence, socioeconomic disparities, social isolation, or lack of pro-social peer networks, or high-risk affiliations, exposure to community violence or gang activity, and then also familial dysfunction, current environment factors and cultural norms, um, dynamics within an individual's family, how the family expresses language and emotion, what behaviors are modeled, um, and then also access to weapons within the home. Some protective factors include stable and supportive relationships, so functional family dynamics, pro-social peer networks, community support and cohesion, neighborhood safety, community engagement, access to identity-based groups. Individual factors include psychological well-being, the ability to emotionally regulate, distress tolerance, problem solving and conflict resolution skills, socioeconomic factors, employment opportunity, financial stability, housing stability. If the basic needs aren't met, we end up seeing additional struggles present themselves, coordination and access to resources. So access to trauma-informed mental health care and substance use treatment, access to education, programs that provide psychoeducation and skill development, and comprehensive, culturally competent delivery of services.
And we continue with psychological impact of homicide on individual, family, and community levels. We found that the impact is profound and multifaceted at all levels. At individual level, survivors of homicide experience severe mental health issues, including depression, drug use, and alcohol abuse. Also, immediate family members of homicide victims face heightened risks of suicidal ideation and post-traumatic stress disorder. Children who witness homicide may experience or be inclined to internalizing or externalizing problematic behaviors. And a homicide perpetrator may face legal consequences such as imprisonment or other forms of punishment that may lead to the loss of freedom, impact on health, and in certain situations, loss of life as well. At family level, families of both victims and perpetrators may face societal judgment, isolation, or discrimination. They may also experience financial constraints associated with either loss of a breadwinner or legal costs pertaining to the perpetrator. In African cultures, customary law practices hold families of homicide perpetrator responsible for compensation payment that is ascertained by the family of the homicide victim. Homicide may lead to strained relationships between family members, especially if the perpetrator is a family member. And we also found that in African cultures, customary law practices may tolerate revenge killing of the most influential family member from the homicide perpetrator's side, which may lead to communal and large-scale violence. At community level, homicide may fuel fear and terror in the community. There may be insecurity, despair, and collective mourning in the community. Businesses and investments may suffer in the area where the homicide was perpetrated. A breakdown in trust and unity may occur, especially if the homicide is associated with gang violence. Increased rates of stress and trauma may lead to high rates of mental health conditions and substance abuse, which is a public health concern itself. At country level, we found that high homicide rates at the country level can strain healthcare systems, law enforcement, and judicial resources. International investments may be impacted, and tourism may also be negatively affected. This, of course, has ramifications on economy of the country. High homicide rates may fuel social unrest, political instability, and lack of trust in governmental structures. Country's reputation may be endangered globally, and respective policy development and implementation may require substantial resources and tangible efforts to be mobilized. I hand over to IPEC.
So to describe our program, we are focusing on four main aspects: psychoeducation, education, advocacy, and reducing risk factors. For psychoeducation, we want to focus on teaching individuals signs and symptoms of aggression, violence, depression, and mood changes, something that they can keep an eye out for in their loved ones or in themselves. As Carly mentioned, we also want to educate people on being independent and learning how to regulate mood, cope with different stressors, things like that. In education, we want to focus on teaching people gun safety. That includes safe gun storage in the home, bystander awareness training to know what to do in a situation when you witness violence, and just general safety when it comes to being around weapons. Our program will also advocate for different needs in the community, such as community segregation and policies that affect housing and resources. These can have a direct impact and influence on crime rates, as limited access to resources can increase crime rates. And then we want to reduce risk factors, in addition to the risk factors that Carly discussed in reducing those with psychoeducation. Another way is to have a safe weapon drop-off, which allows people to remove guns and other weapons from their homes and safely turn them in anonymously to this weapon drop-off. Our program will be held in a urban city center where prevalence is highest, and we will take call-in appointments, walk-ins, and have text services. With this description of our program in mind, our mission statement is to educate, reduce, empower. We want to educate the community, reduce homicide rates, and empower the community members to get help.
When looking at trauma-informed models and strategies, we want to ensure that we have safety and trust building while emphasizing the safety and physical part that comes first while dealing with trauma-informed interventions. And also having clear communication and consistency when helping survivors feel secure. For refugees and marginalized groups, on trafficking survivors, past experiences with authority may make it harder to trust and be patient. But remembering the cultural factors and remembering that everyone is human, to be patient and transparent and non-judgmental, while remembering the cultural responsibilities that tailor to interventions with cultural norms and histories of collective trauma, while also remembering to always use empowerment and considering your voice of tone when dealing with trauma can often strike people with control and empowerment centered approaches to help restore autonomy. We also are going to focus on peer mentoring, skill building, and collaborative goal setting when it comes to survivors to give them a sense of ownership over healing. The cultural factors that we need to consider during staff and congruent messages include individuals with similar lived experiences, such as race, ethnicity, and language. Another cultural factor is community driven. We want to collaborate with residents in the community and have agencies to reach out to when need be, and also faith organizations, while also using health development and partnering with school systems and health departments and outreach and youth support. Considering culturally contextualized prevention and intervention strategies, we want to have healing circles, peer support, mentorship, and leadership programs, while considering restore justice and family-centered work. Also, comprehensive trauma-informed and treatment for victims of SUD and MH. Also focusing on case management and care coordination. Interventions meet survival-based behavior with tactful support and challenge, and individual skill development to promote functional independence, and the cultural factor of attention to structural social determinants of health within the linkage of employment, training, and housing partners programs, to also partnership with hospitals, schools, and local agencies to bridge the gap in care and to bring all cultural together while considering the policy change advocacy.
We want to ensure that our program is successful and is actually serving the community that we're in. So to evaluate our program, we'll implement culturally responsive evaluation strategies and address culturally relevant risk factors, focusing on the outcomes for the individual, family, and community, as well as the entire system. We want to also focus on quantitative public health and criminogenic outcome measures to make sure that our program is working. We'll take a look at statistics like homicide rates and non-fatal shootings, number of emergency department visits related to assault injuries, gang-related incidents, things of this nature, to see how our program is impacting these specific statistics in the community. And then we also want to get qualitative feedback from the people we're serving. That includes participants' perspectives, but also community members who might not be involved in the program, just to see how they think the program is impacting crime rates in their community. And then we also want to hear the perspective of our staff members. Um, do they feel like there is room for improvement? Where could we improve? Things like that. And then to ensure the long-term success of our program, we want to continue monitoring and evaluating so we can conduct a longitudinal and mixed methods study for cultural validity, where we'll triangulate the findings and look for culturally relevant markers of success, trauma recovery in participants and community members, as well as sustainability of the program to make sure that we can continue it for as long as the community needs.